Well, hello and good afternoon. Welcome to the Ontario Network of CAPC CPNP projects, and welcome to our network webinar. I'm really delighted to be here today with our two presenters. We have Malini and Michele with us, who are going to talk about the CheckitOut initiative. And I will let them introduce themselves and launch right into their session with us. But before we do that, I would like to take a moment to welcome all of the folks who are joining us here in our webinar live. It's really great to have you here. We have network members of our from all over Ontario joining us, folks who work with CAPC and CPNP projects. So it's really great to have you here, or whether you're watching the recording, it's wonderful that you're joining us. But before we launch in, I think it's a good time just to pause for a moment and to have some acknowledgement for the First Peoples of our territories from all across our province. And our network does like to pause and acknowledge and thank the First Peoples of the territories where we work and serve, and other Indigenous folks for the sharing of the land that we work on that allows us to come together today and do the work that we do. So eternal gratitude for that. And now we are moving on to our topic, which is an overview of something called the CheckitOut initiative. And I'm really excited to learn more about this. So I'm going to hand it over to Malini and Michele and allow them to introduce themselves. Would you unmute yourselves, Malini and Michele? Make sure we've got you there and got you good. And thanks so much for joining us. I'm going to turn off my camera, but I'm still around if you need me. And I'll hand it over to you. Thank you.
Okay, maybe I'll start. So hello everyone, my name is Michele Lupa and I'm the Executive Director of the Canadian Mothercraft Society, which is a multi-service not-for-profit located in Toronto. We deliver CAPC and CPNP programs through our project called Breaking the Cycle. Just by way of contextualizing my connection beyond that through Mothercraft, I was a CAPC coordinator from 2003 to 2007 with a project in Toronto called Growing Up Healthy Downtown. So the work that all of you do is near and dear to my heart at multiple levels, and I'm really excited to be able to tell you about some work we've been doing here in Toronto around early identification.
Good afternoon, everybody. Thank you so much for giving Michele and I an opportunity to present here today. My name is Malini and I'm a pediatrician working in the community and working at Black Creek Community Health Center. I have a special interest in social pediatrics as determined by the social determinants of health, as well as in developmental and behavioral pediatrics. And I've been lucky enough to work with a fantastic group of partners over the last 10 years. That includes Michele Lupa, Mothercraft, Toronto Public Health, among others. And once again, thank you for having me here today.
So are you going to kick us off, Malini?
Yeah, so I'm going to start by just going to pull up my presentation in just a minute. Okay, so once again, I wanted to start by acknowledging the work of my incredible CheckitOut work group over the last few years. I do feel lucky to be a part of this experience. And Michele and I wanted to share the overview of our work from the past 5 years and walk you through the history of the CheckitOut, as well as the core components of the CheckitOut model and the toolkit. Okay. So these are the organizations who have been the backbone of the project since it actually first started back in 2014. And at the time, the idea was that we would all work together for about 6 months with a small group of one-time funding from what was then the Ministry of Children and Youth Services to put together an early ID screening model based on what was already happening in different parts, in different pockets of the city of Toronto. So what this slide highlights and what we think makes CheckitOut so special is really the cross-sectoral nature of the partnership. If you look at the list of organizations, it's a group which has expertise from an incredibly diverse range of service areas, from primary health care, from public health, population health, child development, family and child protection, family support, special needs support, settlement services for newcomers and refugees, as well as child welfare and child protection. And in addition to the organizational support of these agencies, we also did want to acknowledge the contribution of Dr. Leaford Jones and Dr. Ruth McMannel, both of whom are from the Hospital for Sick Children. So the origins of the CheckitOut partnership is basically been rooted in the early identification and intervention committee of the Toronto Child and Family Network. So back in 2014, the committee decided that there was a need for a more sort of systematic approach to health, development, and well-being in terms of screening for young children. So at the time, there were several organizations, what was then the Ontario Early Years Centre and now the Early On Centres, family resource programs, and other child and family programs across the city that were already conducting what we would call as screening days for families. But there was really no consistency of practice and no coordinated planning in terms of where and when these types of events were offered. So I'm going to pause in order to note and clarify what we mean by screening. It does evoke very specific diagnostic practices for some professions, but that's really not what is intended here. In the CheckitOut context, the word screening is really meant to be an initial conversation, sort of a preliminary set of questions, maybe the use of a simplified tool to determine if there is any cause of concern within a particular health or development area, and whether there needs to be a fuller or a more formal assessment that could potentially lead to a diagnosis. It's just sort of an initial step to see if this is required. And CheckitOut screening events are meant to be a next step whereby parents and caregivers can talk to professionals about their questions or concerns and determine if there's any deeper investigation that is warranted, or to receive information and referral in a setting that is familiar, comfortable, and safe for them. Sorry. Okay. So I'm going to spend a little bit of time on this slide because not only does it provide an overview of several important projects that eventually led to the development of CheckitOut, but it also shows the very purposeful and systematic evolution of new resources, tools, and approaches that have been developed over the last decade to support families at a systems level, specifically those who interact with the specialized sector, service sector in Toronto. So let's get started, which was in 2010. So there have been many successful partnerships in the early ID and special needs sectors. We started around 2010 with Let's Get Started. And at the time, the Toronto network of Ontario Early Years Centres, once again called Early On Child and Family Centres now, they came together with Toronto Public Health, Toronto Children's Services, and agencies serving families whose children required additional supports to develop a program that would better meet their needs. So for those who may not be familiar with Let's Get Started, it was basically a family support program for children who have a developmental diagnosis or those who are awaiting assessment and for whom the more typical family supporting program may not be suitable. For different reasons, they may be too big, they may be just too loud or too busy. And to this day, Let's Get Started programs are scheduled and delivered in a coordinated manner across the city. And at the time, it was an important step towards inclusion. Then came along the Toronto Child and Families Services Pathway. This was developed by the Early ID Committee, service agencies, and system leaders like Toronto Public Health, Toronto Children's Services, and what was then the Ministry of Children and Youth Services. As you all know, there are many challenges across all service systems that can lead to fragmented services, poor coordination of services, and inconsistent access. And funding limitations and siloed service mandates have historically meant that when it comes to especially young children for whom there are health and development concerns, figuring out where to go and what to do can be really overwhelming, not just for the families, but also the professionals who want to help them. So this pathway was meant to simplify what was then a complex system, and it continues to be used across multiple service sectors to this day. The next was a poster series that was the Don't Wait and See. This was developed in 2012. When the introduction of the provincial 18-month well baby visit initiative in 2005 came up, it helped to solidify what was already known about the importance of early childhood development, early identification, and early intervention. Some of the same sector partners who developed the pathway began working on a public awareness campaign to promote the initiative with Don't Wait and See campaign. Some of you may remember seeing these posters. This was in Toronto, and it was basically posters in bus shelters and public spaces here. The posters were translated into 6 different languages, and the campaign did achieve its objective, which was to increase the number of visits parents made to primary care practitioners and advance discourse about the importance of early childhood development and identification. Not long after the campaign ended in 2013, the healthyKidsToronto.ca website was created, and this became the place where all of these materials were stored and can be easily accessed. Then in 2013, the partners once again came together to create the Keeping Track record. As I mentioned before, the system of specialized services can be daunting for families, especially when their children are young and it's unclear what's going on with their child. They often need to engage with multiple specialized service organizations. Assessment and diagnostic activities are taking place. This is a card that's about the same size as our yellow immunization card. And it's meant to keep track of the appointments, the contacts, and next steps for families of children with special needs. And its aim was for families and primary care providers to have access to vital recorded information and to maintain continuity of care. What was already well known at this time was just how often parents of young children with health or developmental concerns repeat their stories and share the same information over and over again. It wasn't enough to create just a tool for keeping track, and we decided that there should be an attempt made to create a common intake tool and process that would allow, with their consent, for the information that a parent shared with one service provider be shared with all of the service providers, so that the family may need to engage with. This took a couple of years, and the Common Intake Project brought together approximately 35 different agencies that delivered specialized services for young children within the city of Toronto to see if an agreement could be reached about common questions to be asked and information to be gathered, so families in theory would only have to provide this information once. There was a lot of interest and a great deal of effort that was put into the development of the Common Intake when it was rolled out in 2015, or a slightly modified version of it. And that brings us to CheckitOut. So this has been the latest collaborative effort of many of these same organizations that first came together almost a decade ago to develop Let's Get Started. So why we wanted to bring this all was at the same time that all of this was happening, it was driven by Ontario's policy transformation agenda. So full day kindergarten was first introduced in 2010. It was fully implemented in 2014. And it changed the landscape of early learning quite significantly. Moving on, mental health. This was the transformation agenda for child and youth mental health. It was introduced in 2012 and really began to shift the way in which this sector was structured. Then there was the 2013 Early Years Policy Framework, which set the stage for the transformation of the early years sectors in childcare, including the enactment of new legislation as well as for speech and language services. There was the province's original poverty reduction strategy, which was renewed and updated in 2014, increasing public discourse on the impact of poverty on overall health outcomes, and specifically for those of us who work with children, the impact on children. And then in 2014, the introduction of the special needs strategy. So in taking this trip down memory lane, we wanted to sort of highlight that our community, the city of Toronto, despite its size and complexity, has managed to keep pace with all of this change. And in fact, sometimes get ahead of it to keep adapting the way our services and systems work together in order to meet the needs of families. So, oh, not sure what happened. Okay. And now to check it out. So one of the first things that we did as a group was to articulate our vision, our goals, and objectives. This helped ground us over the years as the external environment, able to sort of ground ourselves to what we had initially envisioned. It continues to resonate, and it's really the reason we've all stayed so committed over the last 6 years now. So what exactly is Check It Out? It's a community-based one-stop event, providing families with access to professionals who can answer questions about child development, health, and well-being. It's evidence-informed and a manualized approach to address concerns or identify areas that may require further investigation or support. And it's information and referral in the key areas related to screening, assessment, specialized services available, and government programs of relevance to families with young children. And it basically has 4 key components. So I'm going to walk you through each of these components to explain what they entail and why really they matter. So the 12 screening areas were developed in consultation with experts, practitioners, and specialized service providers. Some of them are not going to be a surprise to any of you who are familiar with early childhood development. Some, however, may be surprising. All are meant to be purposeful, and they reflect the holistic multi-sectoral approach that we've prioritized throughout the project. And they have their foundations in evidence and what we know about optimizing health and development outcomes for children. So the 12 screening areas that we developed were access to government supports and services, as well as to the community, access to primary care, communication and literacy, dental health, development, immunization, nutrition, parenting, physical activity and sleep, social and emotional development, and vision and eye health. I'm not going to go into detail on how the events are organized or conducted, and Michele will cover a little bit of that in her review of the evaluation findings. What I will tell you is that all of these screening tools, the key messages, and the resources for each of the 12 screening areas were developed in consultation with the specific subject matter experts who provided invaluable advice and input into the development of a professional's guide, which is used during implementation to ensure consistency throughout the process of implementation. We then went on to develop 6 posters, and the goal of this was to prompt conversations about how children develop and learn, as well as to act out as a means of encouraging families to connect with their family doctor, with their local public health unit or community child and family program, if they have questions or concerns about their child development or well-being. There were child development experts that informed key messages for each of the posters, and the series was very purposeful in using language, images, and an overall approach that was meant to convey inclusiveness and diversity. These are all of the 6 posters at a glance. The third component is partnerships. So partnerships are key to the delivery of Check It Out, in particular with multidisciplinary professionals who have expertise in each of the 12 screening areas. The toolkit contains several resources for building out a pool of professionals who will be integral to the delivery of the screening events, including templates and a database of professionals who can provide the in-kind support. Additionally, partnership with families. with the organization holding the screening event, as well as with the professional participating in it. These are really an important first step in helping families demystify some of the services that they may need in order to interact with. And the idea was to begin to build trust and relationship between the parent and the professional, something that you all know is critical for the success of any intervention. Referral and follow-up. So we know that early identification and intervention leads to improved outcomes for children. We know that the more supports that can be put in place prior to school entry can improve learning. We also know that parent readiness and challenges related to the complexity of systems or of accessing assessments or services can be barriers for families. So this referral and follow-up component is actually a really important part of the Check It Out event. So once a family has met with a professional from a particular health area and they have determined that further investigation is necessary, the professional will make a referral or referrals for the child and family. From there on, some families are ready. They're willing to take the next steps on their own or able to do that. Others may require more support. This could take the form of either finding a quiet place to discuss a concern that has emerged from the screening, and for others, it may be just using an interpreter or a program staff to ensure that they fully understand the information that's being shared. So as part of the toolkit, several resources have been developed to facilitate the referral process. And we'll go over those aspects of the model in a few minutes. However, one of the key things that differentiates Check It Out from most of the screening practices that we reviewed when we started the project was the follow-up component of the model itself. So within 1 month of the screening event, a staff person from the organization that hosted the event, again with consent, will contact families who received a referral. This is typically done over the phone and first and foremost is meant to offer support to the parent with any referrals they may have received, talk about any challenges that they may be experiencing, and help find solutions as well as to answer any questions they may have since attending the screening event. It also affords the agency to provide support to any family who may be struggling with information they receive about the child's health or development. So how are families referred to Check It Out screening events? Any family with a child aged 0 to 4 years can attend a Check It Out event. And some of the ways that they may come to know about it or be referred would include either the parent initiating a conversation with any professional or practitioner they trust about a concern they have about the child's health or development. Staff that work with families observe something that they have concerns about and initiate a conversation with the parent or caregiver. Professionals who engage with families in settings that focus on some but not all of the screening areas. For example, family physicians, public health nurses delivering various courses or programs can also refer to an event. And of course, word of mouth. We know that families talk to one another, so this would be an extremely useful way of getting families to an event. Ideally, with promotion and awareness through the distribution of the posters, as well as the embedding of Check It Out within the system of child and family programs offered across the city, there's really a coordinated effort to ensure every community has access to early childhood events that identify concerns and refer to the next appropriate steps. Without going into all of the sections of the manual, within each section, there are tips, ideas, instructions, and resources on how to plan for a successful screening event. The manual also includes templates and samples for things like flyers, letters, task lists, follow-up, and debriefing. The idea was to create something that would be easy to use and standardize, and to standardize the approach from community to community. This is an example of one of the template tools contained within the manual that a host agency would use to line up local professionals who have engaged and agreed to assist with the delivery of a Check It Out screening event. And this is just a screenshot from the professional's guide that I mentioned earlier. As you can see, there are specific tools identified that can be used at an event. The key messages, the column in blue, provides information that should be shared with parents. Professionals are not really limited to these messages, but it's recommended that at a minimum, they ensure families receive this information. And finally, there's a standard list of takeaway resources and materials that should be offered to parents in each of the 12 screening areas. And as much as possible, an effort has been made to make this plain language and family friendly. The toolkit also includes several important handouts for families. So we have the Child Development, Health and Wellbeing Passport. This is an easy tool to help parents navigate through all of the 12 screening areas and keep track of any referrals that they may receive. And then there's an activity booklet, which is a fun booklet with activities for children to complete while at a Check It Out event. And then there's also a tips booklet, which is a takeaway booklet for parents that provides high-level information about each of the screening areas, things to think about. They also have links to more information. Oh. Okay. Actually, that was the last slide. The last one was going to be questions and comments. So where do we go from here? What we're working on currently is, as with any event, trying to find funding. But we're also working on doing a more extensive evaluation, more than what we've done so far. And Michelle's going to talk about the evaluation and our pilot project. And we hope to take this beyond Toronto, throughout the province, and translation of the manual itself and training. So I'll stop here and let Michele take over.
Okay.
I'm gonna actually stop here.
Okay, now it's my turn to figure out the technology. You did so well, Malini. Okay, I think I've got it. Sydney gave us such good training, and now mine's not working. There, can you see me?
There you go.
There we go.
Perfect.
Okay, so thanks, Malini, for that great overview. I'm sure folks have questions. We'll maybe wait till I finish to take any questions that you may have. I'm going to apologize in advance. I'm fighting a cold. You may have seen me drinking and coughing, and I'm going to try really hard not to have a little respiratory breakdown here. So bear with me, please. After all that great work was done to actually build out the model, learn from what others were doing, figure out what we needed to include in something that was more standardized and could be implemented across an entire community like Toronto and systemized, we felt that we had some ideas that we thought we needed to test. So there were a number of different approaches, obviously, that have been happening in different parts of our community, and we thought they had value, and it might be worth figuring out, what works best, what might need to be tweaked, and what would we want to learn in order to be thinking about a system-wide rollout. So we conducted a pilot, and we engaged with a number of Ontario Early Years Centres at that time, because it was being done in 2017. As Malini's mentioned a few times, they're now the early ons, as you all well know. And when we worked with our partners at Toronto Public Health to develop an evaluation scheme and questions and approach. And that's what I'm going to walk you through and share with you now. So the purpose of our pilot evaluation was to test the three main models that we had developed around the delivery of Check It Out, assess the effectiveness of each, and figure out what we could learn and what we might need to adapt. So in terms of the goals, we wanted to see how well were we able to attract and engage families using some of the templates and the approaches that are outlined in the toolkit. We wanted to look at the resources required around the implementation or delivery of the Check It Out events, and figure out, again, what might need to be tweaked or changed or modified. And then we also wanted to deepen our understanding about all the different components, the models themselves, of course, but also things like the referral and follow-up, the approach to partnership, the awareness and outreach, etc., and figure out if there were certain approaches or strategies that worked better in some places than others, and what we might want to amend within the toolkit before we sort of released it out into the world and shared it with all kinds of folks, which, by the way, I'll just mention, we held the launch of all of this work. Malini mentioned it started in 2014, but we formally launched in Toronto last February 2019, where we made all the materials available, walked people through this exact presentation, and it was there that actually we invited a large group of cross-sectoral practitioners, and some of our friends from the Public Health Agency of Canada were there, and they're actually the ones who recommended that we come and talk to all of you. So it's taken a little while to coordinate schedules, but we're so thrilled that we're finally able to share with our CAPC and CPNP friends across the province. So just to start, there were three delivery models that we were aware of and or developed for Check It Out events. The first being what we call a single day directed, and that means that all of the domains or the stations are made available with professionals staffing them on a single day, and when families come to attend them, we tell them you start here and you go in this order. The second model was, again, the idea of hosting all of the professionals and talking about having stations for all of the domains on a single day, but not directing where families go. So just leaving it to them to decide where they go and if they go to all of the stations. I will just take a pause for a second to mention that in each of the pilots and in any implementation, it's not necessary to have a separate station for every domain, because some of them are fairly simple and straightforward and really are about a conversation, whereas others, there are specific tools that specific professionals are administering, and so based on sort of some of the planning limitations, space requirements, time, etc., the coordinating agencies or the host agencies can determine how they might want to combine domains. So in most instances in our pilots, some of the 12 domains were put together, and then others were left on their own. And so just to wrap up the different model types, the third model was what we called a multi-day series, and that was where the coordinating agency decided to hold a Check It Out event over multiple days. That could have been once a week, it could have been every other day, could have been every other couple of weeks. That was up to them to decide. But at each of the events, there would be specific domains that were covered with the professionals there to go through the screenings and have the conversations, and until all 12 were offered. So whether that was once a week over 3 weeks, or whether that was every other day over the course of a week and a half, or however that got set up, it was up to the coordinating agencies with their partners to determine what was going to work best for them. Our objectives in setting up the pilots and then evaluating them, as I said in the goals, we wanted to see how much people actually came out. They may have said that they wanted to come out, but did they actually show up? Whether or not the models that we had in place were effective. Was there one that was better than the other? Are there certain things about the process associated with one that might want to learn about? Whether the families actually gained awareness related to the health and development areas. What the limitations might have been for agencies who were hosting. Did they have enough capacity to go with what we were proposing? Were there things that we hadn't thought about that they could tell us we need to factor in, etc.? And then whether or not, related to the follow-up component, whether or not families actually followed through on the referrals and or the recommendations of the screeners. So just to give you a little sense of where the pilot sites were and where the families came from, for those of you who are in the GTA, this may be a familiar map. For those of you that aren't, this is the city of Toronto. And so you can see with the red dots, those are the locations of the pilot sites. And we specifically recruited sites that would be offered geographic representation. So we thought about north, south, east, west, and trying to also think about demographics, though that was a little more difficult given the limitations of our resources in terms of the piloting, but we felt really good about having a good spread across the city of those pilot sites. So that's the red dots, and you can see all the names of whom are CAPC and CPNP. And then what the colors show you, and what was so interesting to us, is where the families came from who actually attended the Check It Out events. So you can see as the colors get more dense, that means there were higher numbers of families from that particular neighborhood, and then all the way to the lighter colors, which shows lower numbers from the neighborhood. But what was interesting to me, and if you know anything about Toronto, it's a big city. We certainly have a good transportation system, but it isn't a great transportation system. And when you have little people, it can be difficult to get around, especially in the outer suburbs. But based on this map, and this was based on postal codes that we asked people to provide, they did travel. And they came from some pretty big distances to attend these Check It Out events. So that signaled to us that there was demand and interest on the part of parents to be able to access these professionals, and that they were willing to travel as necessary in order to access them. So who attended our Check It Out pilot events? So we had about 127 children actually participate, and we asked for ages, and as Malini mentioned, it's targeted at children aged 0 to 4. And what was really interesting for us here, and this is the circle that you'll see on the left of the screen, was the breakdown of the ages. We fully expected to see a lot of preschoolers because, as I said, what was driving, as Malini said, what was driving a lot of this work was the desire to identify children early so that we could support families in having supports in place, specialized services, etc., for school entry. And so we fully expected to see a lot of preschoolers. We did not expect to see a lot of babies and toddlers, and so it was interesting to us that the distribution was almost equal if you look at those numbers. And then on the other hand, it's not surprising because new parents are maybe on parental leave and have the time to come out to an event like this. We also know new parents with little ones are just like sponges for information. So they're looking to get information about the things that they have questions about as much as possible. And so it also wasn't a surprise, but this was a really interesting distribution for us. What was also interesting is that of the families who came, how many of them actually had more than one child. And so not surprisingly, not very many families came who had 3 children, because I don't know how you wrangle 3 children out the door in a timely way to be at a particular place at a particular time. I got 2, and that was tough enough. And it's also not surprising that the vast majority had only 1 child, but a significant number had 2 children, and so that was of interest to us as well. In terms of who the families were, this gives you a sense of demographics. We collected a lot of demographic information. I should just say that over the course of these slides, there's a lot of information I'm sharing, but there's also a lot that's not included. We did a really intensive evaluation, but we're just sort of highlighting things for you here. So you can see the majority of families spoke English. And then we've listed the other major languages that were represented through the survey collection that we did. And that's not surprising for a place like Toronto, that there was a broad distribution. I forget the total number of languages, but there's a lot of folks speaking a lot of different languages here, but most do speak English. And then the demographics related to income levels. So all along, our priority has been to try to provide access to the professionals and to provide information to families who may not otherwise be able to access it. And so lower income families certainly are a priority. Newcomers, immigrants and refugees are a priority. And so we were happy to see that from an income perspective for those folks who are in a lower income demographic, that they were coming out because we had a lot of information to share about things like government programs that put money in people's pockets, as well as where there are free services through that domain, access to services. But interestingly, there was a pretty wide distribution, because at the end of the day, we know parents just want information, and it's not always easy to get it in a single place. So happy to see that we had some variety across the income brackets there. Related to our first objective about how well the screenings were attended, the events, at the 8 pilot sites, we had 152 children pre-registered when we measured at a 2-week period prior to the actual pilot events. And then in terms of who actually showed up, we had an 84% attendance rate, which we were very pleased about, because people aren't always able to come, even though they might like to. Interestingly, 79% of the multi-day participants came to all 3 sessions. So in our pilots, the ones that did multi-day did it over 3 weeks, so 3 separate days. That was interesting to us, because we certainly expected to see drop off, but it wasn't as much as actually happened. And that again speaks to, for us, that there's a lot of interest and appetite on the part of parents to get information. The effectiveness of the models and how the screenings went. So if you remember back to the 3 different models, there was single day directed, single day non-directed, and multi-day. And so we fully expected that at the non-directeds, where parents got to choose where they would go, that they might not go to all 12 of the screening areas, but in fact that was not the case. So the vast majority of the families who came to the events went to all of the stations to get information about all 12 domains. The different bar charts here relate to the 3 different model types. On average, the family spent about 2.5 hours at each of our CheckitOut events that were part of the pilot. You can see the breakdown there. The multi-day it took a bit more time because it was over multiple days, and so probably from start to finish with registrations and sort of exit activities that added a bit, but not too much more. And what was really interesting to us, which is on a future slide, is that they were okay with that. In terms of the 12 domains and where time was spent by families, nutrition was the area that they spent the most time, on average 16 minutes, which was too much time. And in part that was because of the nature of the tool that was being used, which was the NutriStep. It's a big, long tool, and so one of our takeaways was, is there a modified version of that? Because we don't want families, you end up getting backlog, and that can affect uptake, and so we really wanted to look at that, and we're continuing to have those conversations with our colleagues in public health about how we can do that a little more quickly. And so this is the slide I was referring to a minute ago, between 69 and 81% of parents agreed with the statement that the time I had to wait between stations was okay. So, we as service providers sometimes fret about stuff like this, and I know that all of the pilots were really concerned about wait times and whether people would drop off as a consequence. But even in the single day directed, which was the model that took, it didn't take any more time based on the overall averages, but it felt like it did because people had to go in a certain order. They still were okay with the wait times. And I think that, again, is about the value of the information. So here are some of the comments that we received from our screeners, as well as our coordinating host agencies, from the focus groups that we held post pilot events. And so you can see some of the feedback. We were worried about noise levels, and so it was a bit quieter at the multi-days compared to the single days, because it was just a little less going on. The single day directed model did result in backlogs and longer wait times, although not significant, but again, it felt that way for folks. And in fact, what that's led us to do is completely remove that single day directed model from our toolkit, because in fact, there's no value add in forcing people to go in a particular order. And the main thing is that they have a good experience and they get the information that they need. The development area that the parents reported learning the most in was child development. I don't think there's any surprise there, followed by social emotional development and government services. You can see them all there ranked in order based on the responses from the families. And that the majority of the parents had a really good experience and would not only recommend CheckitOut to their family and friends, but reported that they had a good time at the event and that their children had a good time at the event, though the children didn't have quite as good a time, it would seem. Objective number 4 about organizational capacity, where there are enough staff and other resources. 88% of our pilot site respondents said that they felt that they had just the right amount of staffing. It did vary from agency to agency. It was up to them to determine how many staff they needed. Some of them used volunteers. Some of them asked for and recruited excuse me, more than one screener at those 2 stations in particular: parenting and social emotional and child development, communication literacy. That's where they were kind of bundled up. The individual host agencies' resources did affect the family's experience. Families told us that it was really important to them that there be child minding and snacks, and the screeners told us that it would have been helpful for them to have interpreters and laptops. Excuse me. For some of the resource referrals and for some of the information that they wanted to provide. Again, it wasn't a requirement that any of those be provided. It was recommended, and that's in the toolkit. But what we learned through the pilot, and it would be no surprise to any of you, is that it's helpful to have child minding, snacks, interpreters, and for the screeners, the laptops. How did the referral and follow-up go? So this is the piece that we think is somewhat unique and a really important part of CheckitOut. As Malini mentioned, that 1-month check-in. So between 31 and 43% of all of our screenings resulted in a referral. And the highest number was in the vision and eye health station area. 89% of the children that were screened across all of the pilots actually received a referral for a deeper investigation. 70% of children got referrals around access to government services, and that was things like information about child tax benefit, about dental programs outside of what the dental domain would have offered, some of the family support programs would be available in their community. Sorry. I'm going to wrap up soon because clearly my voice is going. Of the 73 children who received referrals, 75% of them were reached and gave us consent to reach out to them. 75% were reached. Now, this is an area where we've learned that we had some work to do, and that was about being clear before families left about what they needed to do with the referral information that they were given, as well as, I'm so sorry, as well as making sure that parents understood the processes related to actually accessing the service. So you can see in there, and I'm not going to go through it too terribly much, but 44% of the parents that we contacted in the follow-up period, so that's 1 month after the event, did not actually access the referral that they were given. They either didn't understand that they were supposed to, or they didn't feel that it was relevant to them any longer. We have 22% that told us they were waiting, so they'd made an appointment or they were planning to make an appointment. Only 16% had actually, and you know, that's not a surprising number, because I'm sure, like many of your communities, we do have wait lists for specialized services here, and that is a bit of a concern about, we identify children earlier as needing deeper investigation, and then they got to sit on a list and wait. 16% of the families that we contacted did actually access the referrals that they were given. 9% we had some missing data, so we learned some things about how we were collecting the information from all of the host agencies about these 1-month follow-up calls. And then 9% were sitting on wait lists, and these were mostly in the speech and language area. This is my almost last slide. This is just a quote from one of our screeners, who just really, the feedback has been tremendous about the work that we've been doing. And Malini's talked a little bit about what's next, and we continue to work on a system rollout across the City of Toronto with our partners in our municipal government and all of the different service sectors. But we're hoping that we can also take the tools and the work that we've done to translate and interpret. So French language, we would love to be able to work on a toolkit with Indigenous partners about how the model would need to be modified to work for Indigenous families. We want to think about evaluation. In fact, Malini and some of our partners are already deep into that work, and we want to roll out the poster series. So just leave you with this slide, that this is the website that's been mentioned a couple of times. All of the resources that were created, all of the evaluation results, templates, etc., as well as all of the materials in that timeline that Malini walked you through, are available on this website. Obviously not with the Check It Out, that's specific to Check It Out on the tab, but you can find everything there. So how do we do for time, Sydney? Woo!
Pretty good. Oh, thank you so much. You're a real trooper. I really empathize with your cough there, but you made it through it. This is awesome.
Yeah, I hope it wasn't too bad, and I'm sorry for those listening to
No, it's good. It's all good. There was a comment / question from Tina, who says, it would be interesting to see the breakdown of the city income levels. Is this comparable? Do you have any feedback for that?
You mean sort of how did the participation rates and the income distribution compare to the citywide averages? I presume that.
I don't know if Tina, if you want to indicate a little bit more around your comment there. I'm not exactly sure what you might have been thinking. But just something, I guess, for pondering.
Sure. Yeah. I mean, I would say in terms of the distributions that we saw at the Check It Out pilot, I don't think those are reflective of citywide averages of incomes, or the distribution of income levels by percentage across the entire city of Toronto. But it fit with what we wanted to do in terms of the geographical distribution, and it matched that, right? So we were purposeful in, as I said, that north, south, east, west. We were also thinking about who our targets are, which, as I mentioned, was lower income families, newcomer and immigrant and refugee families. And so that, to me, was reflected somewhat. I don't know if you agree, Malini, but some of the neighborhoods where the pilot sites were held are higher income neighborhoods, and that's because they're in the middle of the city, and we didn't want to leave out the middle of the city. Also, out in the outer reaches, you know, the income levels and distributions are a bit lower maybe than the city averages, and so, you know, we would have expected, hopefully, if we were effective, to have seen more of those lower income families coming out. So I hope that maybe answers the question.
Absolutely. Just a follow-up question. Was the waitlist situation a consideration on who you brought onto the screening process?
Short answer would be no. The work that we did with all of our partners and with all of the experts to determine the 12 domains was very thorough and thoughtful about what is it that we really want to achieve in terms of identification and intervention. And we did have lots of conversations about, you know, what about when you identify and then people have to sit on a wait list. We felt that, and we get asked this question a lot, that the more that we can identify the needs that young children have around their development and health and well-being, the more we can use that information to continue to advocate for more service, more of those specialized services. So, you know, the wait lists are terrible and they're already too big, but if we get an even more fulsome picture of how many children actually need these services, maybe we can move the needle a little bit with our advocacy efforts to say we need more specialized services available.
Awesome. Thank you. There's another question here. What inspired you to call the initiative Check It Out?
Do you remember, Malini? I don't know if I remember.
To be honest, I don't. I think we always felt it has to be something that we needed to check the children out for, but I think over time it became something that we asked the community to do for us, sort of, you know, come and check it out, check out a screening event and see. But I don't remember.
Yeah. Maybe this is the moment where I can respond to, I know you sent us in advance, Sydney, a question from someone from Hamilton asking about the connection between the Hamilton Check It Out drop-ins, and there is no connection. I did go and check out that website. It sounds interesting. It looks totally different or somewhat different. You know, the reality is I know there's certain names of initiatives that are kind of popular around the province, and that was just an example of that, and we were not aware, but thanks for sharing that.
Great. Thank you. Well, I want to express my gratitude to both of you for coming and telling us all about this initiative. I have quite a few questions myself, but we're kind of running out of time. But I wonder, I mean, I just love the effort of, you know, the coming together in collaboration and partnership, and, you know, the motivation to reduce the need for families to kind of repeat their stories over and over again, to just sort of have that one-stop shop. I think that's really fabulous. And maybe this is a big question, but I guess my mind goes to around, do you have any challenges or strategies around like what you do with the information, how you hold it, how do all these organizations share it? Again, I realize that's a big question that maybe can't be answered in 30 seconds or less, but do you have? Do
you mean the individual family information?
Yeah, when you're taking it, because I would imagine then this information, does it belong to a particular agency, or how do you handle that?
Well, the host agencies really play a critical role, and in the case of our pilots, that was the OEYCs or /early ons, but that could be CAPC projects, it could be community centers, our local library has been really interested, community health centers where Malini works. And so they take on that responsibility for all of the coordination and organization, and they have primarily those relationships with the families to get them to come out, though others are involved in the outreach. And so it really is for them to, you know, use their internal policies and practices around holding on to the information, keeping it protected. We did do a lot of investigation about whether any of this falls under PHIPA. It does not.
Okay.
We're very concerned about that. All of the doctors that were part of our initiative were concerned about that. We're not asking or collecting anything that is considered private health information or personal health information.
Right.
So there weren't any of those concerns.
Right. Well, thank you. That's
Can I maybe say one more thing to conclusion, Sydney, for everybody who's on the webinar to just know where we're at? Like, so this started as a Toronto initiative. It continues to be a Toronto initiative, but our collective vision and my own personal, you know, sort of bandwagon that I'm on is that this really is something that should be available to every child in the province of Ontario, and one could even, you know, think bigger, but right now we're trying to, you know, keep our ambitions somewhat manageable. And so we have done a lot of work to engage with both the Ministry of Education, the Ministry of Children, Community and Social Services, and even we did apply for a federal grant a couple of years ago on when there was that call for early childhood social innovation initiatives. And, you know, in our group, so we're trying to stay focused on the task at hand, which is to really make sure this is available to every family in Toronto. But we are keenly interested in figuring out ways to work with Indigenous organizations about how might this be modified, would it be useful, and could it be modified, and is there something that could be available for families. Those families, rural and remote, we know it looks very different in different parts of Ontario about how you might approach some of this and the resources that might be available. So there's been a lot of talk amongst the Ontario network of early on centers, and so certainly happy to continue the conversation with your network, or to hear from folks who may have ideas about that. We haven't had a lot of traction just yet, but we're keeping at it.
That's great. And you have put the website where folks can go. That'll be on slides and in the information. Is the toolkit available there?
Everything is there for download for free.
Okay.
The toolkit, the materials, the templates, everything.
Mm-hmm. Wonderful.
The posters as well.
And the posters.
Yep.
That is really awesome. And I'm sure there'll be lots of folks who'll be really interested and excited, and even taking, learning what they can from your experience and seeing what can translate. I'm sure it'll be very helpful. So, well, that is our time today. Thank you again, Malini and Michele, for joining us. I really appreciate you taking the time to come and share all of this exciting work with us. And I'd like to extend my gratitude to the folks who have joined us live today. It was great to have such a wonderful turnout. And I'll be sharing the link recording and checking in with the presenters if they're willing to share their slides. I think they were. So we'll make sure they're available to everyone, and we'll send you all kinds of good luck and support for the continuation of this project. You're doing such great work, and hopefully we can continue sharing information about it. So let's keep that going.
That would be great. And I'll just quickly mention that somebody asked about infant mental health promotion, and we are both very actively involved in IMP. And Malini and I are going to be traveling to Australia to the World Association of Infant Mental Health conference to share what we've been doing here in Toronto with Dr. Jean Clinton in June. So stay tuned. Maybe we'll get some international traction too.
Fabulous. Well, safe travels, and we look forward to hearing all about it. And I hope everybody has a wonderful weekend. Some folks are in storm warnings, so stay safe and cozy.
Stay safe.
And I hope you're feeling better, Michele. Thank you for being such a trooper.
Thank you.
Hopefully that chest cold clears up for you. And again, thank you both. It was great to have you here, and I hope you have a wonderful rest of the day.
Thank you very much.
Thank you.
Mm-hmm. Bye-bye.
Bye.